Hello everyone. Today we will discuss convulsions in the newborn period. Convulsion in the newborn are sudden, repetitive, abnormal motor, sensory or behavioral events caused by excessive neuronal activity. They are neurological emergency indicating the underlying brain dysfunction. If it occurs in the first 28 days of life and the incidence is usually 1 to 3 per 1000 live birth, commonly it is due to hypoxic ischemic injury or metabolic causes. Neonatal seizures are often subtle due to the immature nervous system. Subtle seizures can cause eye deviation, blinking, sucking, bicycling and apnea. Clonic seizures can cause rhythmic jerking of limbs or face. Tonic seizure can cause sustained limb stiffening. Myoclonic seizure can cause brief sudden muscle jerks. EEG is confirmatory for most of the neonatal seizures. So what are all the common causes of convulsions? So the most common causes of convulsion is hypoxemic ischemic encephalopathy, followed by intracranial hemorrhage, which is more common in preterm, followed by metabolic disturbances, infections in the CNS, developmental anomalies, inborn errors of metabolism, drug withdrawal or toxicity, others like citrus or sepsis. Hypoxemic ischemic encephalopathy is the most common cause of neonatal convulsion. This happens due to oxygen deprivation during childbirth. Seizures usually appear within 12 to 24 hours of life, often associated with low Apgar scores, and encephalopathy requires supportive care, seizure control, and neuroprotection. Intracranial hemorrhage are more common in preterm infants due to the fragile germinal matrix, and the types are subdural, subarachnoid, intraventricular, or parenchymal hemorrhage caused by birth trauma, asphyxia, or coagulation disorders. It presents with apnea, bulging fontanelle, and focal seizures. It is actually diagnosed by cranial ultrasound or an MRI. Coming to the metabolic convulsions. Hypoglycemia is the most common cause in preterm, IUGR, or infant of diabetic mother. Hypocalcemia, usually occur in 2 to 5 days of life, may cause jitteryness or seizures. Hypomagnesemia, it is often associated with hypocalcemia. Hyponatremia due to excess fluid therapy or renal salt loss. Prompt correction of electrolyte can cause stoppage of these type of seizures. Coming to CNS infections like meningitis, encephalitis or torch infections, seizures are accompanied usually by fever, irritability, poor feeding, bulging fontanelle. CSF analysis and neuroimaging aid in the diagnosis. It requires antibiotics or antivirals and seizure control. Coming to structural and developmental anomalies. Examples include cortical malformation, lissencephaly, hydrocephalus, agenesis of corpus callosum. It is often associated with persistent seizures and developmental delay. MRI is usually diagnostic as they are mostly space-occupying lesions. Management is usually supportive and symptomatic. Inborn errors of metabolism can also cause convulsions. That includes amino acidopathies, urea cycle defects, organic acidemias, pyridoxine-dependent seizures. They present with refractive seizures, lethargy, vomiting, and metabolic acidosis. Drug withdrawal or toxicity. Seen in neonates of mothers who took opioids, barbiturates, or benzodiazepines. Symptoms include tremors, irritability, high-pitched cry, or seizures. Usually, it occurs in 2 to 3 days after birth. Supportive care and slow tapering are required. Other miscellaneous causes include citrus, where severe hyperbilirubinemia causes damage in the basal ganglia. Sepsis from systemic infection leading to metabolic derangements. Maternal eclampsia or magnesium therapy can also contribute. Prompt diagnosis and management may improve the outcomes. So approach to the neonatal seizures includes stabilizing of airway, breathing and circulation, checking glucose, calcium and electrolytes, ruling out infections and metabolic causes, neuroimaging if structural cause is suspected, treat with anticonvulsants if seizures persist even after correction. Common drugs include phenobarbital, phenytoin, and levocetirizine. The take-home message is neonatal seizures are a sign of serious brain dysfunction. Most common causes include hypoxic ischemic encephalopathy, metabolic issues, and hemorrhage. Early recognition and treatment of reversible causes are vital. Long-term outcome depends upon the etiology and timely intervention. I hope you learned from this video. Thank you.